This week, a case report was published describing the tragic and preventable death of an 11-year-old boy from rabies. This case resonated with me in particular because myself, my wife, and our 1-year-old son were all treated for rabies. While living in a mountain cabin, we woke up one morning to a bat flying around our shared sleeping space. While we had no bites or scratches, bat bites are infamously hard to detect. Also, despite what movies suggest, bats and not dogs are currently the leading source of human rabies infections in North America. So, we immediately sought out the extremely effective post exposure prophylaxis consisting of rabies immunoglobulin and vaccination. Frustratingly, no one local ER had more than one dose of the immunoglobulin, which meant 3 separate ER visits. Each time we needed to explain to the ER doctor why treatment was necessary, highlighting that many doctors are not that familiar with rabies. Going back to that case report, a previously healthy 11-year-old boy began experiencing numbness and tingling on the right side of his face, followed by facial swelling and difficulty swallowing. His family initially brought him to an urgent care clinic where he was prescribed an antiviral for suspected Bell's palsy. This presumptive diagnosis should already have caused some pause, as Bell's palsy typically first presents with facial paralysis and not sensory symptoms. When the boy's symptoms worsened a few days later, he was brought to an ER. He was tachycardic with oral ulcers and mild sensory deficits of the face, but otherwise looked well. Labs showed only an elevated white blood cell count. At this time, his family mentioned that 3 weeks earlier, while staying in vacation home, the boy had been woken up by a bat landing on his face. He swatted it away, and his father released it outside. Because there were no visible bites or scratches, and the bat did not appear to be acting strangely, the family had not sought medical attention at the time. The ER doc contacted public health authorities about possible rabies, but for unclear reasons, the boy was discharged home with a diagnosis of a viral mouth infection due to herpes. The next morning, the boy returned to the ER now with facial weakness and slurred speech. This time he was admitted with a working diagnosis once again of a herpes infection. His condition rapidly deteriorated. He developed fever, confusion, hallucinations, and respiratory failure requiring intubation. At this point, infectious diseases was consulted, who suspected rabies, which testing confirmed on hospital day 4. Unfortunately, there is no effective treatment for rabies once an unvaccinated person has become symptomatic. After 2 more weeks of intensive supportive care, his family opted to withdraw life-sustaining therapies as recovery was deemed impossible. The bottom line: if you wake up in a room with a bat, even without a bite or scratch, seek medical care that day. Rabies is almost universally fatal after symptoms begin, but it is almost universally preventable before they do.